I'm Alice. Welcome to my Women's Health series. Today, I'm going to be investigating why science is still catching up on women's health and how women are treated in the healthcare system. Okay, so today's episode is going to be a little bit different, maybe a little bit longer, but stick with me because this is really interesting. Let me just give you some background. Historically, scientific research has been centered around the male body, and females have been excluded from studies. It was argued that variables are easier to control when studying the male body. However, this has meant medicines were produced and prescribed to both men and women on the basis that they worked for men. The reality is that some medicine that works for men doesn't work for women. In fact, it can actually harm women, and it has. Women have actually died because of this. It wasn't until 1993 that the National Institutes of Health updated policy to require the inclusion of women in clinical trials. And it was as recent as 2014 that the National Institutes of Health updated their policies that animal and cell model research also required consideration of both sexes. So things are different now, and science is hopefully catching up. However, this historic lack of research on women has actually left us with a deficit in our understanding of female biology. This, along with societal and systemic biases, might be impacting how women are treated in the healthcare service today. So I'm going to investigate this. To start with, I'm going to talk to the public. Let's see what they have to say. So my question is, do you think there's a difference between how men and women are treated by healthcare professionals?
Does it matter that we are healthcare professionals?
I do, actually. Yeah, I really do.
Yeah, I do.
Yes, massively. Massively.
And I think it depends on the context, no?
And obviously there are very great differences between the needs of men and women.
I don't know, certain GPs might be better with women or not.
A few decades ago, this whole idea of hysteria, so women's symptoms were laid down or attributed to something that wasn't physical.
I think you're often not taken seriously as a woman. Your issues are treated as kind of, I don't know, not to be Victorian, but like hysteria or something like that.
I mean, I still see it in healthcare today.
Sorry, I could really go off on a tangent here.
Certain medical conditions present in different ways if you're a man or if you're a woman.
Medical tests, for instance, are done on men, on male bodies, as if that's the default.
Textbooks, just there's one way that a heart attack presents, for example, but which discriminates against women.
Have you ever personally felt dismissed by a healthcare professional?
Oh, very good question, isn't it?
Yeah, I have.
There have been times, yes. Yeah.
I don't think I've ever felt like I've been dismissed by.
I would say I haven't. I don't think I've been dismissed by pressure either.
Okay, so some people had some really interesting things to say. It was nice to see the young healthcare professionals being very aware of the topic. I'm now going to talk to Dr. Louise Newson. She is a medical doctor who specialises in hormone treatments and the menopause. I want to see if she's come across any of the ideas we've spoken about today in her practice. Let's see what she has to say. So to start with, could you just tell me what motivates you to do the work that you do?
I'm really driven by the injustice of women not being allowed to choose a future better health because they're being denied evidence-based treatment. So it's anger that keeps me going often.
So as a practicing medical doctor and in your field specifically, have you come across any evidence of medical biases against women or the fact that science is still catching up a bit on women's health?
Yeah, I mean, my clinic is busy. We've got 50,000 patients and they're all women who've been underserved by the NHS. So they come because they can't get access to evidence-based treatment. We see a lot of patients who come from psychiatric hospitals, a lot of people who have been under psychiatrists. Most of our patients have been offered or given antidepressants, yet no one's thought about their hormones. I think one of the problems is people aren't believed, women aren't believed. So many women who come and see me just thank me because I've listened to them and I've understood them. And I think that's a really sad place to be, that these women have real symptoms some of them physical, sometimes mental health, and people haven't believed them, or they've tried to say they're due to something else. Even if I don't have the tools to treat them, you have to respect and listen to patients. And, the more women I speak to, not just in my clinic, but through sort of social media and events that I do, women are not being believed. And I think that's a really sad state of affairs. There's no psychological advantage for women making up symptoms, and they don't. I really believe that they don't.
So I've heard that testosterone can be given as part of hormone replacement therapy for menopause. I've also heard that it's not really a first line treatment, and sometimes it might only be prescribed in relation to libido, even though there's evidence that it can help with much more for women. Could you tell me more about that?
It's a very important hormone, and it's because it's been mislabeled as a male hormone that people are scared and worried about it. If you look at the guidelines and you look at the most solid evidence for women, it's for helping with libido. Which is no surprise, but we know from our data, but lots of other data as well, mood, energy, concentration, stamina, sleep, muscle joint pains, headaches, migraines, palpitations, flushes, sweats can all improve with testosterone. Some menopause societies say that women have to have HSDD, which is hypoactive sexual desire disorder. And if you look up the criteria, it's very barbaric. A lot of women I speak to are told that they don't need testosterone because they don't have a partner. I don't see why women can't have a libido if they don't have a partner. I think a lot of it is the patriarchy of medicine trying to control women, unfortunately. But I feel that often women are being judged or misjudged, and I don't think that's the right place in a consulting room.
It sounds like it could be a really important hormone to help women through the menopause. Could you tell me a bit more about what the research situation is with it?
We've got really good data for men about how effective it is for disease prevention. And we can't ignore that data because any other medicine in medicine, we use data from men because they haven't had good female studies. But somehow with testosterone, it's become very blinkered that we can't use the male testosterone. We have to wait for female testosterone data.
It seems to me that there is an aspect of medical misogyny or bias and a lack of research and understanding when it comes to women's health. I think the judgment and dismissal that women face, as described by Dr. Newson, really reflect this. Thank you for watching today. I'll catch you next time.